WHO's member states are negotiating a new pandemic accord and amendments to the international health regulations to strengthen the legal framework for the global response to pandemics.
The World Health Organization's governing health body is scheduled to meet in less than 2 weeks to discuss ratifying existing legally binding health policies and strengthening future pandemic responses. Here is what you need to know.
Why didn't this Prime Minister establish a public health inquiry into our COVID response before considering signing amendments to the international health regulations?
The World Health Assembly is the decision-making body of the WHO, the World Health Organization, a United Nations agency dedicated to promoting global health and access to high levels of healthcare, or so they say. The WHO will meet from May 27th to June 1st at UN headquarters in Geneva, Switzerland, to discuss healthcare agendas created by its executive board. According to the composition of the board, a woman named Miss Christine Harmston from the Public Health Agency of Canada serves as the Director General from the Office of International Affairs for the Health Portfolio and comprises this board. With nearly 3 decades of bureaucratic experience under her belt, according to her LinkedIn profile, no Canadian actually democratically voted for her to be in this decision-making position. The unelected, unaccountable globalist think tank called the World Economic Forum tells us that this unelected and also unaccountable WHA is important to shape the future of global health and health care, from increased reliance on digitization and smart connectivity to foster international collaborations to develop and distribute vaccines for diseases like malaria and COVID-19. This time, it is presumed that the WHO will meet to vote on changes to legally binding international health regulations and discuss a new pandemic agreement, something that we have been reporting on at exposethewho.com for years. Since this executive board has not given the 95 member states, Canada included, the required 4-month adoption process timeline to make this magnitude of legally binding change, some have called this a conspiracy to violate due process.
The idea here is that Article 55, in its basic purpose, is intended to support the principle of fair and due notice. And fair notice means that notice is timely and complete.
According to Article 55 of the WHA's own rules, they would have had to submit the final version of their proposed amendments by January 27th earlier this year to give member states that 4 months to review before voting in a few weeks. But as of last month, they weren't even in agreement on the package of amendments. Now, if the member states vote on these proposed amendments, that would be doing so in blatant disregard for due process and the necessary time frame mandated by the WHO itself for the consideration of such legally binding alterations. According to the WHA's own rules, a quorum or a majority must be present to put forward a vote. Yet moving forward on these proposed amendments were approved by a sparsely attended meeting in 2022 in the strangest way, where it looked pretty awkward that no one was even paying attention.
To make sure that if the committee now ready to approve the draft resolutions contained in A75/A Conf 7 Revision 1, the financial and administrative implication of this resolution may be found in document A75A/Conf/7 I am asking you if the committee is ready to approve the draft resolution in question. I see no objection. Therefore, the resolution is adopted with these amendments. Therefore, I repeat, the resolution is approved with amendment.
Now, the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, says that the legal framework of pandemic responses needs to be strengthened, but that does not go far enough.
The next pandemic is not a question of if, but of when. and we cannot afford to repeat the same mistake of the past. That's why WHO's member states are negotiating a new pandemic accord and amendments to the international health regulations to strengthen the legal framework for the global response to pandemics. And we can't stop there. We must follow through with national ratification and accountable implementation. For the sake of future generations, we must not go back to the old cycle of panic and neglect that left our world vulnerable. We are stronger together.
National ratification and accountable implementation, except that anytime the WHO gets together to discuss the COVID-19 pandemic or other responses, there's no acknowledgement of the grotesque harms caused by devastated lockdowns, indiscriminate mandates from masking to vaccine passports as the precursor to digital IDs under the guise of a digital health partnership to facilitate global mobility and protect citizens from ongoing and future health threats. The international health regulations will mandate intellectual, technological, and genetic sharing under the guise of equity, diversity, and inclusion. It will implement a biosurveillance state of global governance that mandates the sharing of your biometric data and immunity status through pharmacological adherence. Conservative MP Leslyn Lewis penned a letter to the Federal Minister of Health, Mark Holland, with her concerns about the skirting of due process and the continued strengthening of the WHO in absence of this accountability. Lewis noted the failures of the WHO on a global and national scale, the expansive claim of public health that suspended civil liberties broadly and at length, and ceding too much of our sovereign pandemic response authorities to the unelected bureaucrats at the WHO that can declare a public health emergency of international concern at the whim of the appointed Director General. Lewis expresses concern that the federal government has not had a thorough and public assessment of Canada's COVID-19 response, including national and WHO failures. She notes the lack of disclosure of the final complete text of the IHR amendments, which she calls an extremely serious matter of national concern, when combined with the new treaty or accord that would yield Canada's healthcare sovereignty to the whims of the WHO during a public health emergency. Minister Lewis calls this undemocratic and unacceptable before moving on to her fourth point, that there are issues with direct connection to healthcare emergencies listed in the WHO's draft pandemic instrument, such as climate change, mandatory resource and technology transfers, limitations on free speech, etc. Lewis also notes that wording is important. If the WHO adopts the proposed pandemic treaty or agreement as an accord, then it would require a lower threshold of parliamentary scrutiny. Now, as the WHO will likely attempt to push through these sweeping amendments at the end of this month, be aware that the WHO is a private organization, with its second largest funder being Bill Gates through his efforts at the Bill and Melinda Gates Foundation. And he wants to ensure that drills are being done to prepare for epidemics every 5 years.
The WHO is going to need more resources to have a dedicated team, not just for when the epidemic comes, but to go to the world's countries and make sure that these drills are being done. We do fire drills. The Defense Department does war games. We need for epidemics to practice. In fact, one of the reasons why Australia did well is that it, like Taiwan, was threatened by SARS-CoV-1. And so this idea of, okay, who are these PCR people? How do you get them engaged? It was partly practiced because of that previous threat. And so we need to be doing every 5 years a really comprehensive exercise at both country and regional level of pandemic preparedness. And you need a global group that's kind of scoring everybody and saying, hey, if you're not participating in this, you could be the source of the next pandemic, and that's bad for the entire world. This is like a fire that goes global.
Now, Canadians, did you vote for this? If you'd like to exercise your democratic voice, Minister Lewis lists your members of parliament in her Substack and also senators so that you can get involved. For Rebel News, I'm Tamara Ugolini. You can also get involved at our expose website at exposethewho.com to keep healthcare local and not mandated by globalist entities with pharmaceutical interests, please sign our petition there, and also consider supporting our work if you enjoy these kinds of reports. All of that and more at exposethewho.com.